Good morning everyone. Today I'll be speaking on the topic comparison between sodium hyaluronate and carboxymethylcellulose eye drop in treating dry eye disease. I have no financial disclosure. Dry eye presents with pain, ocular discomfort, limited vision impacts the quality of life. Dry eye can be divided into aqueous deficient and evaporative disease. Aqueous is further divided into Sjogren's and non-Sjogren's, which is Sjogren's has primary and secondary causes. Non-Sjogren's has lacrimal deficiency, lacrimal gland duct obstruction, reflex block, systemic drugs. And evaporative has intrinsic and extrinsic causes. In intrinsic, we have meibomian oil deficiency, disorders of lid aperture, low blink rate, drug action like Accutane. Extrinsic causes has vitamin A deficiency, topical drug preservatives, contact lens wear, ocular surface disease like allergies. Observational study was carried out during a period of 5 months from March to August 2023 in our tertiary care hospital, comprised of 40 patients randomly allotted to receive 0.1% sodium hyaluronate and 0.5% CMC eye drops 3 to 4 times a day for an 8-week period. TBUT Shermer's test without anesthesia and dry eye symptom score found using the ocular surface disease index were assessed at baseline and 4 months and 4 weeks and 8 weeks of treatment. Carboxymethylcellulose is an anionic polymer of glucopyranose subunits which helps in water retention and has moistening properties. Sodium hyaluronate is a glycosaminoglycan found in vitreous and tears and has the ability to tether water molecules and avoid tear film desiccation. Study approved by our hospital ethics committee, informed consent obtained from the participants. Patients with symptomatic dry eye disease with OSDI score more than 13 were in the inclusion criteria. Prior refractive surgery, active ocular infection, contact lens wearers, use of any ocular medications within 14 days of study enrollment were in the exclusion criteria. 40 randomly allotted patients, of which 17 patients were male, 23 patients were female. TBUT less than 10 seconds into evaporative group, which has computer vision syndrome. Shermer value less than 10 mm into aqueous deficient group. Alter TBUT and Shermer's test were considered in the combined dry eye disease. TBUT is done using fluorescent impregnated strip. Dry is distributed by blinking was then observed under cobalt blue filter. Time interval between last blink and development of first dry spot was taken. Normal value being more than 10 seconds, anything less was considered as dry eye disease. Shermer test was done using Wortmann filter paper of 41. This was done without using any topical anesthesia. Value less than 10 mm was taken as abnormal. CMC group had 9, as a result, CMC group had 9 males and 11 females, and sodium hyaluronate group had 8 males and 12 females. The participants had a mean age of 42.63 years and CMC had 45.67 years in sodium hyaluronate group. This is the data we have collected over a 5-month period. Evaporative dry eye disease had 15 patients in total. Aqueous deficient group had 13 patients in total. Combined dry eye disease had 12 patients in total. This is the total data we have collected over the 5 months period. And we can clearly see the graphical presentation that in CMC group, the OSDI score is decreasing and TBUT and Shermer test results were increasing. And sodium hyaluronate had superior decrease in value of OSDI score. And sodium hyaluronate group demonstrated slightly higher increase in TBUT values than the CMC group. Though literature stresses on the anionic nature of the CMC and its effectiveness on tear retention time, the contradictory result in a study can be because of the greater epithelial repair and greater viscosity of sodium hyaluronate. Its limitations of our study are its short duration of 8 weeks, which was inadequate to assess the changes in conjunctival cytology. Commercially available SH used in the study had, in addition to 0.1% SH, glycerin as an aqueous buffer, which might have modified the results. Using Shermer's test and TBUT was the lack of standardization with low reproducibility. SH, to conclude my study, SH and CMC are equally effective in treating mild to moderate dry eye disease, with greater improvement observed in terms of subjective symptoms of SH. Both SH and CMC improved the objective parameters for dry eye disease over the 8-week treatment course, with better outcome obtained for sodium hyaluronate. Thank you. These are my references. Yes, ma'am. But I'm not included in the study because there were no sufficient.
Measure?
No, actually there were no sufficient data for the study over the 5 months period.